Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through June 9th, 2022. This week, I'm going to play off the question that we asked last week, which is while all the numbers seem to be coming down, why are we hearing about an increase in cases? It's almost like anecdotally, we're hearing about a lot of people who've gotten COVID even after being vaccinated. So let's check the numbers that are coming down. Globally, we continue to see this decline in the total number of deaths, the lowest point by far that it's been. To give you a sense, we had about 10,500 deaths last week. At the peaks from 2020, 2021, we were seeing 14 to 15,000 deaths every day. So considerably lower than it has been. In the United States, we were following with a little bit of concern the resurgence in number of cases, but as you can see for the last few days, it's been coming down. The same is true with hospitalizations. We were seeing an increase in those. They're coming down, though as you can see, predominantly the older folks, still those over 65. In terms of deaths, the numbers aren't continuing to go down, but they're certainly staying level at about the lowest point they've been at any time since the pandemic began. Now, it's a little bit hard, you want to look at this and say, well, the pandemic is over, but you might have said the same thing back in June, July of 2021. So we'll keep our eye on it. To date, over 1 million deaths in the US and about 2,600 deaths last week. In terms of where the cases have been, we were watching sort of a resurgence in cases in the Northeast. It seemed to be sort of coming down across the upper Midwest and down the eastern seaboard. And then it seems to be lightening up a little bit now, maybe coming back, but it doesn't seem to have any geographic pattern right now, though perhaps one could suggest that there's a pattern in Kentucky, Illinois, and that. So against those numbers, we keep hearing about an increase in cases. Last week, we talked about an article out of New York that suggested that we might have 30 times more cases than those that we know about. And the reason is many people are not getting tested because they don't feel very sick, especially those who've been vaccinated. And then some folks, they realize that they can't afford to miss work, so they're not getting tested. But probably the main factor is that many people who are getting tested are using home test kits, which currently aren't being reported. And if you have a positive test at home and you're not very sick, you may well not talk to your doctor. And because many cases now are occurring in folks who've been vaccinated and boosted and who therefore don't get very sick, these are likely also not to be reported to healthcare providers. It's also an interesting hypothesis that the folks who are most cautious, who are more likely to wear masks and social distance and be vaccinated and boosted, went a long time without getting COVID. Now, as people are lightening up in their protective mechanisms, we may all be exposed to it. So again, the bottom line is the numbers are low and they seem to be coming down and staying down. This increase in cases is probably real. It probably reflects, as I say, folks who are being tested at home. So we talk to each other, but we're not getting reported to the healthcare system. But we certainly want to keep an eye on the total number of cases. So a great deal more information about COVID-19 on the College of Public Health website. As always, we get nice emails from folks thanking us for doing these weekly updates and telling us that they share them with other people. If other folks would like to be added, please let us know. Thanks as always to Dara Young for editing, producing, and posting this video. And if you have any questions about this video or any aspect of the COVID-19 pandemic, please let me know. I look forward to hearing from you. Until next week, I seriously hope that you're well.